There are two main types of outcome in clinical trials at least for cancer drugs. One is showing that you're having an effect, and the other one is showing that you're having an effect on the patient. So the first one, effect on the tumour, second one, effect on the patient. The most important is the effect on the patient. That's the one that is important to the patient, and it's also likely to be clinically important. Just because you shrink a tumour doesn't necessarily mean you're improving patient outcomes. So these surrogate endpoints, rather than overall survival, are less important. So wherever possible, you should be choosing an endpoint that can directly impact on patients. Overall survival should ideally be reported in every study. For adjuvant studies, that could potentially mean having to wait 15, 20 plus years for at least proof that your overall survival has improved. That's obviously very difficult because medicine doesn't change at that rate, it changes almost on an annual basis. So there is a need for a surrogate marker. If you are going to use a surrogate marker, it's got to be one that's validated, where you've actually shown that there is a direct link to overall survival. In terms of choosing the wrong outcome measure, it will have two impacts. One, it means that there's potentially a medicine that's being approved for use, which is not going to have the desired effect on patients. The other impact is it means we're also potentially wasting money. And at a point where resources are quite tight, the last thing we want to be doing is wasting funds on medicines that are not delivering benefits for patients. So we have to be really careful about that. There is usually a right answer for the outcome measure that you choose. Ideally, if everybody else has done it, and it's validated, then you need a really good reason for not doing it. If, on the other hand, you're looking at a brand new outcome measure, then great, but you will need to validate it, which means it's not a single study, you're probably going to need 5 or 6.